Hello, my name is Jyoti Sunar. My father's name is Dilip Sunar. We are from Shillong, Meghalaya. We came to Narayana Hospital few months back in the month of April. We were hopeless when we came here. We came from Shillong. He was already admitted in Shillong for 2 months. And then the doctors out there had nothing to do. They couldn't find out what his illness was. And we were hopeless. We had no option. So then we went to Google to find out a doctor suitable for his illness, what could be done to him. And then that way we came to Narayana Hospital. Dr. Digvijay Sharma did his surgery. It was found out that he had a major intestine blockage. Then he had to undergo major 2 surgeries. Post his hemicolectomy, his stoma was taken out. Then after that we were suggested to go for a chemotherapy, and then we met Dr. Naresh Jadhav, who is doing his treatment presently, and my father is doing brilliantly good. Even we can't imagine what we brought him here and what we can see of him now. He uses his phone, he talks to us. He was literally not talking. We brought him in a very, very hopeless situation here, and what we see now is a miracle. And this hospital, these doctors are no less than God to me, because they have given me back my father, who can talk to me, who uses his phone, talks to his friends, goes out, goes for a drive, eats well. If you would see him now, you would all be surprised. He eats well, he dances with us, he sings, his life is back to normal. And then today also we brought him hospital, and he came up to the 2nd floor without any wheelchair. And I'm not giving a feedback just because it's a feedback. It really comes from my heart that the doctors here, this hospital, means God to me. And I hope in future everyone who comes here, who visits this place, experience this. And I hope everyone who is facing this problem gets well soon. And I hope to see my father going back to office, doing his normal work again. And I'm just happy and grateful, very, very grateful to Dr. Digvijay Sharma and Dr. Naresh Jadhav.
Hi, I'm Dr. Naresh Jadhav, Consultant Medical Oncologist at Narayana Super Specialty Hospital, Guwahati. This is about the journey of our patient, Mr. Dilip Sunar, who is a middle-aged gentleman hailing from Shillong, Meghalaya. Mr. Sunar was suffering from abdominal pain for quite some time, for which he showed to local doctors in Shillong. Despite the best efforts of his local doctors, they were unable to pinpoint the exact cause of his abdominal pain, and the patient continued to have these symptoms for quite some time. For this, he went to a tertiary care center in Shillong, wherein he underwent some imaging studies and was found to have growth in his colon. They evaluated him further, and he was diagnosed to have adenocarcinoma of colon. Once he learned of his diagnosis, he decided to take treatment at Guwahati and came to our center. Unfortunately, by the time he landed up with us, patient had developed intestinal obstruction and was in severe abdominal pain and had other related complications. He was seen by our GI surgeon, Dr. Digvijay Sharma, who decided to undertake an emergency laparotomy because the patient was in intestinal obstruction. The surgery was done, the surgery was successful. It was a good oncological surgery was being able to be done. Post-operatively, when the histopathology specimen was studied, it was found that the patient had a number of high-risk factors for recurrence. So we discussed the patient in our multidisciplinary tumor board, and it was decided to give adjuvant chemotherapy for this patient. Now, adjuvant chemotherapy in colon cancer is generally given for a period of 6 months. There are 2 types of adjuvant chemotherapies that we offer to these patients. One is FOLFOX, which is solely an injectable chemotherapy which is given every 2 weeks for up to 12 cycles, and one is Capox, which has an oral component of therapy to it, which is given every 3 weeks for 8 cycles. Considering the fact that patient was from Shillong and had several logistic limitations in going up and down from his hometown, and also considering the prevailing COVID scenario, it was decided in the best interest of everybody that the patient gets 8 cycles of Capox. That would reduce his hospitalization time and would obviously reduce his visits to the hospital. So patient started on Capox after his surgery, and patient has been tolerating the chemotherapy very well. There has been a significant improvement in the general condition of the patient. He has gained weight, and today patient has come for his 5th cycle of chemotherapy, and I'm really happy to say that he is really tolerating the chemotherapies very well and is really doing well. Thank you.